I'm Dr. Megan Graff, Doctor of Physical Therapy and avid runner. I've run over 25 marathons over the last decade or so and numerous other races in between. I also have a passion for working with runners in my practice, so I'm excited to be able to bring this information to you and help you on your running journey. Now let's talk about some of the health benefits of running. Studies have shown that consistent running can lower your blood pressure and resting heart rate, improve blood sugar control, lower your triglycerides, and lower cholesterol. It can also reduce your waist circumference and body fat percentage. Improving these markers of health can reduce your overall disease risk and help you feel healthier overall. Running helps reduce stress and improve your mood through mood-boosting endorphins. You should be able to perform your usual activities of daily living, including walking for 30 minutes without having any increased pain. Now let's go through some of the movements to try to test out your readiness to run. First, we have the single leg stand. You're simply going to lift one leg up and try to balance for at least 10 seconds. Be sure to try it on both legs. Running is essentially a repetitive single leg stand, one after the other, so having strength and stability in this position is very important. Now let's take a look at the single leg squat. Try to perform 10 repetitions on each leg of about a quarter depth. This is a more dynamic test that also tests single leg strength and stability, but it requires more muscle control, like running, more than just standing on one leg. Third, try jogging on the spot for 1 minute. This allows you to see how your body handles light impact. These next movement tests are plyometric, or the impact component of running. For jump squats, focus on starting low and landing low. Don't land on stiff legs. Try to keep your knees in line with your feet and don't let your knees collapse inward towards each other. Try to perform 10 to 15 repetitions. Lastly, we have the single leg hop in place. Simply jump up and down on one leg for 10 to 15 repetitions or 30 seconds straight. You can use a countertop or something for balance if you need to. If you have discomfort with any of these movements or felt like any of them were significantly challenging, use these movements as a little workout routine for 2 to 3 weeks to build up strength and balance before beginning running. This will help your running feel stronger and help you prevent injuries when you do get started. Starting running can feel really overwhelming. If you're new to running or getting back into it after a long time off, the best place to start is with a walk jog. This means instead of trying to go out for a 30-minute jog right away, you break it down into intervals of walking followed by an interval of jogging. Earlier we tested that you can walk for 30 minutes without any problem, so let's take that same 30 minutes and add some jogging into it. Start with a 5-minute walk followed by a 1-minute jog. This should be done at an easy conversational pace. Repeat that 5 times to get to your 30 minutes total. Only 5 of that is going to be actually jogging. This is a much more manageable place to start with your running journey. From here, you will progress to the next phase of 4 minutes of walking and 2 minutes of jogging, and then 3 minutes and 3 minutes, and so on, until you reach 30 minutes of continuous jogging. You can progress to the next phase as quickly as every other day. Always take at least 1 day in between these runs, though. If any symptoms, such as pain, arise, or if you're excessively sore, take an extra day off, or even go back to the previous phase. Once you hit that 30 minutes of continuous jogging, then you can find a training plan to build up longer times, more mileage, or increased intensity. It's very important to monitor how your body is handling this new training. The key things that you want to watch out for are, if there's pain that's increasing during your run, especially if it's a sharp pain or of severe intensity, then you should stop or walk. However, if you feel some discomfort at the start of your run, give your body a little bit of time, at least 3 to 5 minutes, to see how it responds before you stop altogether. Oftentimes you will feel your body loosen up after a few minutes, and it'll start to feel better if you were experiencing some discomfort at the start. If you have pain later in the day or the next morning, take time off from running and just walk, as long as that is also pain-free. If you're still sore 2 mornings later, again, be sure to take an extra day of rest. Increase about 10% mileage or time per week after you've reached that 30 minutes of continuous jogging. For example, 1 week you run 9 miles total, the next week you can run about 10 miles total. And it's better to break that up over more days, such as running 5 days of 2 miles versus 2 days of 5 miles. It's less stress on your body all at once. If you're becoming symptomatic, again, such as having new pain or soreness that doesn't subside after 2 days, back off your mileage. All in all, running is great for your health and easy to get started. Be sure to try each of the movements to test your readiness to run, then progress to completing your walk-jog intervals before you build up to longer runs. Be sure to monitor your body's response to running and take extra days off when needed to allow your body to recover.